Hello, welcome. My name is Jessica. We're so excited to have you join for our core body portion. This class is designed specifically for postpartum. Make sure that you're cleared by your medical provider. Also, if you don't have blocks for class, you can use any kind of modifications such as soup cans or any kind of canned food from the pantry. Let's go ahead and get started. In a seated position, you can have your legs in a crossed position, or if it's more comfortable, you can always bring them in a butterfly position or even have one leg out. This class is for you. Make sure you feel comfortable in your body. We're going to start just with a centering breath for the mind and the body. Let's extend the arms all the way out to the sides. Take a deep inhale breath. Breathe up, palms overhead in prayer. Close the eyes if it feels good, and then exhale down to the top of the head. In between your eyes and down to the heart center. We're going to do 3 all breaths. Take a nice inhale breath through your nose and begin. 2 more. Inhale. Last one. Take a full inhale and let it go. Exhale. Let's go ahead and bring those palms over the rib cage now. Fingertips forward, thumbs back. We're going to focus on rib cage breathing. We want to bring in those transverse abdominals, the inner abdominal layer. Also activating pelvic floor. Let's take an inhale into the rib cage. So feel that expansion. Breathe in through the nose and then exhale. Now I want you to bring rib cage and pelvic floor. Lift it up with the belly button all the way up and in. Again, inhale. Feel the expansion. Exhale. Let's do 2 more. Inhale through nose. And then exhale through mouth. Last one, a little bit more dynamic. Inhale. And a nice forceful exhale. Feeling that pelvic floor lift, the core stays nice and tight. I want you to feel that engagement. Keep it there as you find your breath. Pelvic floor should feel lifted, so the muscles from hip bone to hip bone, tailbone to pubic bone, and all the way up through the low belly, middle belly, and through the ribs. And then let it go. Deep breath in and out. Let's transition on to all fours, palms underneath the chest, knees underneath our hips. So we're in a cat-cow position. Now the goal here is to really find that core, so tabletop spine. So let's take a nice inhale breath. Let the belly drop without moving the spine. And then exhale. We're going to just pull that belly in, but keep that spine nice and flat. So again, inhale, we're not moving here. And then exhale, pull belly up off of the floor. Good. Let's go ahead and do a couple more of those. So inhale, drop belly, not the spine, and then exhale, pull belly in. And let's do that one more time. Inhale, drop the belly, but don't move the body. And then exhale, pull it in. Now I want you to feel those rib cages pulling in together, and then activate the back portion of the pelvic floor. So pull that also in together. Keep that nice tight engagement, and let's go ahead and inhale, slide that right leg all the way back. So notice if your rib cage drops down. Let's pull that belly rib cage back in. The eye gaze is forward, neck is nice and long. Christine over here is going to be doing some modifications. So I want you to check in with your body. On an inhale, let's lift that right leg. And check in here. Did the rib cage drop down? Did the belly drop? If so, we're gonna pull it back in. Maybe you stay right here where Christine is gonna stay. If you wanna move on to the advancement Julia's gonna show us, we can inhale and lift that left arm straight out. So we're balancing on one arm and one leg. Again, check in with your rib cage. Did that drop down? Did the belly drop? Let's pull it all in nice and tight. And then exhale, Julia's gonna show us knee and elbow meet. And then inhale, extend. So we want to be very mindful here. We're not dropping the belly or finding an arch. Good. Now, Christine can also show us, we can add on here. If she's not ready for the arm, she can still find a dynamic pull-in with that right knee. So exhale, pull it in. Good. Inhale, and then slide it back. We'll do 3 more here. With each exhale, we're pulling in or we're holding, depending on where your core is today. Checking in with that rib cage, checking in with the belly. Not allowing it to drop and expand. We want to protect those abdominal muscles from pulling out, especially if you have any kind of diastasis recti. Let's go ahead and do our last one here, and then come back into a neutral spine. And let's find cat-cow. So we inhale, drop the belly, eyes and tailbone up. This time we're moving the spine. And then exhale, round. Good. So tuck the chin a little bit more. Good. Find that nice stretch. And then inhale, let's lift it up. And exhale, round. As you round, pull in the rib cage, pull in the pelvic floor, and then one more time, inhale. And exhale, we round. Now I want you to keep a slightly rounded spine here. Ribs are in, abdominals are in, and pelvic floor is tight and engaged. Let's go ahead and slide that left leg back, and let's do the opposite side. So eye gaze is now forward. Our tight core is activated. Inhale, lift the left leg. Good. Notice where your ribs are in your hips. We want level hips. Ribs are pulled in nice and tight. We're gonna stay either where Christine is if you need that modification, if you feel that the belly is dropping or the ribs, or we're gonna move over into Julia's portion with the right arm reaching forward on an inhale breath. So again, check in with the body. Very important. Check in with the core as we breathe here. Deep breath in and deep breath out. We want to make sure the hips are nice and level here. Good. And we can add in that dynamic piece with an exhale breath. Pull in knee to elbow, or just the knee if you need the modification. Sometimes when we add in moving through arms, it can activate the abs when we're not ready and pull them. So we're going to modify with Christine if we feel that belly or rib cage dropping down. Good. Keep breathing. Exhale. We feel the low belly pull in. We're feeling the strong glutes in the legs. And let's go ahead and find 2 more here. Always exhaling because that activates your pelvic floor. And our last one. And then finish up and come back down into box. Let's inhale into cow. Open up, tail up, eyes up, exhale, cat. And just breathing here, moving the spine, feeling how the body feels in this pose. And find 1 more. Deep exhale. Keep the ribs in, belly in, pelvic floor nice and engaged. We're moving over into fire hydrant. Let's inhale, lift that right leg. Flex the toes. And I want you to notice if the weight shifted into that left arm. Let's shift it over to the right arm. Maybe put a slight bend in the elbows. Eye gaze is forward. Again, check in with your ribs. Keep them tight, belly tight. And let's find a tiny little pulse. We exhale. That dynamic breath, it activates the core and the pelvic floor. We're pulsing, hips are level, weights even in the hands for 5, 4, 3, 2, and 1. Keep it there. Breathe. Big breath in. Good. Big breath out. Drop that right knee down. Let's move over to the left. So inhale, breath, activate core, and then inhale, lift the left leg. Again, notice the weight in the hands. Do we need to shift it to the left hand? We want the weight even. Little slight bend in the elbows, flex the toes, and we pulse. Just a tiny little pulse. It doesn't have to be a lot here. Rib cage is in, core is in. We're breathing for 5, 4, 3, 2, 1. Hold. Breathe. Deep breath in, core is nice and tight. And release. Reset with a cow. Inhale, eyes up, tail up. Exhale, round through a cat. Good. From here, we're going to go ahead and slide our toes underneath our feet and move up into a hovering pose. So I want you to hover your knees off the floor, activate those ribs and core again. Good. Breathe here, eye gaze forward. And then press up into downward facing dog. Heels press back, chest towards the thighs, and the head hangs down. We're doing a nice deep inhale breath through the nose. Breathe into the rib cage. Good. And as you exhale, you can go a little deeper in your pose if you want. Maybe you want to pedal the feet back and forth. So just notice how the body feels. Do you need stillness or do you need movement in your downward dog? Make sure the head is heavy. You can shake it from side to side. Chest presses towards the thighs. Press down through all 10 fingers, through the base of the palms, through the thumb, all of the fingers. Take one more nice inhale. And exhale, long breath out and pull in that pelvic floor. So I want you to feel that pelvic floor. Keep that engagement and let's slowly lower down to the knees. Inhale into cow. Exhale, round into cat. And we're going to take our blocks for this portion. And again, if you don't have blocks, you can use soup cans here. So let's go ahead and take a nice inhale and lift that right leg forward and that left knee stays back for a nice low lunge. We're going to be here just for a second, but we want to inhale and lift up through the heart center. Engage the core, curl the left toes, and lift up into a high lunge. From here, we want to make sure that that back leg is really strong and stable. Eye gaze is forward, so looking up through the chest. Good, nice deep breath. Nice deep breath out. Good. Now from here, we're going to transition to warrior two with a very strong core and pelvic floor. Let's lower that left heel and then lift up and extend that left arm out and then the right leg forward, or right arm forward. Now from here, tuck the tailbone under, lift up through our heart center, pull the shoulders down and back. Good. Tight ribs. Remember, when we're postpartum, sometimes the belly wants to pull forward. We want to pull it all in. Good. Nice, strong warriors. Back leg is strong, heel is rooted down. Good. One more breath. Let's breathe. Good. How's your pelvic floor? Activate that pelvic floor. Core in. And then from here, let's step it all the way forward. Inhale, reach those arms up. Exhale, elbows in. Lift that right leg, flex the toes. So a little balance here. Belly's activated. Let's breathe. Inhale, reach it up. And exhale. If you want to make it dynamic, follow Julia. Inhale, reach up and kick on that exhale. If you need a modification, you can just hold like Christy, breathing here, focusing in on balance. All right, let's go ahead and do two more. And last one. And we hold those elbows down, squeeze those shoulder blades, core is tight. And then lower right foot down. Inhale, big breath, reach up, arms overhead, and exhale, forward fold, flat back. Hands to the blocks. Inhale, halfway lift. Chin is forward, belly in. Exhale, fold. Feel that nice stretch at the backs of the legs. All right, palms to the blocks. Inhale, let's lift up. And then let's go ahead and lower the knees down to the ground. Slide the blocks forward, hands down. Inhale with a cow. Reset with your cat, exhale. Ribs in, belly in. We're moving to downward facing dog with a hover first. Curl the toes, inhale, lift and hover. Couple breaths, ribs in, pelvic floor in, eye gaze forward for 3, 2, and 1. Downward facing dog. Press the hips back, heels back, chest towards the thighs, and the head is nice and relaxed. Let's take a nice inhale breath. And exhale, let it go. Good, one more breath here. Inhale. Exhale. Activate pelvic floor, core tight, and then come all the way forward. Hands to the blocks. slide that left leg forward. Our transitional lunge here, so just inhale, one breath, lift up through the heart, activate the pelvic floor and core, curl the right toes, and lift into high lunge. Breathe. Now here's where we really feel our core activate. That right leg is nice and strong. Good. Breathing here for 2 and 1. Let's move to warrior 2. Right heel down, inhale, right arm back, left arm forward, sink into that left knee. Tuck the tailbone under and lift up through the heart center. Pull the shoulders gently back. Good, breathe. Full breath as you lift through that pelvic floor. Core is nice and tight. Good, we're calming the mind and the body while working on strength. Finding strength through the core, finding strength through the mind and the breath. One more full breath cycle here. And on this next inhale, we're gonna step it forward, lift that right foot, inhale, arms up. Here's our balance. Lift up through that right leg, flex the toes. Good, we're gonna hold here, elbows down into the chest. And if you're ready for dynamic portion, inhale, arms up, and exhale, kick. If you need a modification, we're just gonna hold. Good, nice few breaths. 3, 2, and 1. Hold. Breathe, flex the toes, lift up through your heart, ribs are down and in, and then lower that right leg down. Root down through the feet, flipping the palms forward. I want you to feel a nice tall spine. Slightly tuck the tailbone under. Maybe you feel the weight rock back to your heels. Rib cage is in. Feel the alignment of your body and your core. Chin is slightly back and tucked. Top of the head is rooting up to the sky. Let's now take a full inhale breath. Reach the arms overhead, palms touch. And exhale, forward fold, flat back. Ribs are in, hands to the blocks. Inhale, halfway lift, eye gazes forward. And exhale, fold. Find that nice stretch. Let's go ahead and lower down to the knees, back to the palms. Let's find our transitional cat-cow. Inhale, open up, lift up. Exhale, rally, tuck. Rib cage is in. Now from here, we're going to transition onto the floor on our back. So just go ahead and slide onto your hip. And then anytime in postpartum we're coming to the floor, we want to be mindful where we first come to the side and then we roll over to the back. So that way we protect our abdominal muscles. So as we come to our back, our feet are forward, our heels are slided towards our glutes here. Tuck under the shoulder blades. Tuck the chin, the neck is nice and long. We're gonna do a couple of pelvic rocks here. I want you to feel the pelvis with the core and the rib cage. The main goal here is to keep the spine completely flat. So as you take an inhale breath, I want you to breathe into the ribs and slightly find a little arch of the lower back off the ground. And as you exhale, now I want you to flatten the ribs down and then flatten the lower back. And we'll do that again. We inhale, we just slightly arch up. And then exhale, pull in that pelvic floor again, all the way to the ribs. And then again, inhale just slightly. And exhale, tuck. Good, nice and flat. And I want you to hold that flat. At any point, if you feel your lower back is lifting off of the ground, that's a sign that your core's not quite ready for that movement. And then you can come back to this foundational pose where we just focus on ribs down, back nice and flat, and a slight tuck in that tailbone. So keeping that engagement, on your next inhale, let's press down through heels and palms and lift our hips slightly up. Doesn't have to be too high. We don't want to dump weight into our necks and our shoulders. We want to just find a slight lift with a muscle activation here. So as you're in your bridge pose, I want you to hold this pose, but not the breath. we're breathing. Deep inhale breath, a deep exhale. And as you do this pose, I want you to notice, is your pelvis lifting into an arch? We want to make sure we maintain that flat spine. So a slight little tuck in the tailbone. That's the goal in this pose here. It seems like it's not much, but we're actually working a lot of important muscles here for your postpartum core. So we're breathing into the low belly, into the ribs, and activating. Let's do one more deep breath here. Good, and then go ahead and lower back down. And just find a neutral spine, whatever feels good. If there's some kind of movement that your body needs, you can always find some movement. Like Julia's moving her knees back and forth. And let's just take a couple more deep breaths, wherever you are, for 3, for 2, and 1. Good. All right, now staying with that neutral spine, let's find a belly breath. We're going to inhale back into the belly, into the ribs. And let's exhale, pull it all in. So pelvic floor, low belly, middle, upper belly pulls in. And then from here, let's lift our feet off of the ground. So I'm going to show you a modification here. If you notice your lower back is lifting off of the ground, then you're just going to bring your feet in and your knees in, closer to the body. Now, if you want to be more advanced, if your core feels ready, where your lower back isn't lifting, you're going to be like Julia, where your legs are in a nice 90-degree angle. The knees are stacked right over the hips. We're flexing our toes. That activates our pelvic floor and our core. The goal in this pose is not to let that lower back arch off of the ground. So if at any point you feel it arching and lifting, you can either modify like Christine by bringing those knees in and the feet a little lower, or you could back out completely and go back to that foundational bridge pose. We're breathing here. We're never holding our breath. We're working that core, keeping rib cage tucked down. Pelvic floor is activated. Good, breathe. If you want more for your core here and you want it dynamic following Julia, we're going to lift up the arms now. So notice the ribs. What did the rib cage do? We want to keep it tucked down. Good. So if you want even more for your core, we're going to inhale that right leg forward, left arm back. Yes, moving into our bug pose, dynamic bug, and then bring it back on the exhale. Inhale, opposite side, left leg forward, right arm back. Good. And now you can alternate, Julia, from side to side, following her, going right to left, opposite leg, opposite arm, keeping ribs down, breathing. Good, flexing toes back. And wherever you are, if you need a break, you can take a break. But we're gonna find a few more breaths on each side in that dynamic pose. Good, let's go ahead and even it out. So one side, exhale, bring it in. And then let's finish up with that last side. Inhale and exhale, bring it in. Good, now big bear hug. Wrap your arms, hug your knees into the chest, and maybe rock side to side. See if your low back needs a little bit of comfort here. And just find a soothing rock, soothing breath. Breathing in and breathing out. Good, your core is probably feeling this now. It doesn't seem like it's a lot, but this is very foundational and very important for postpartum. Let's find one more deep breath here. And one more deep exhale. We're going to come into relaxation. You finish this portion of class. You can always visit this class again for more core. So let's go ahead and find what pose we want to do for relaxation. If you want to come into full Shavasana like Julia with legs out, toes out, palms up, you can. If you want to modify like Christine, if your lower back is feeling any kind of pain, come into a butterfly pose with the soles of the feet together and the knees can come out. You can also stay in a bridge pose if you feel any discomfort in the back. We want to take care of our body here. Everybody's body is going to be in a different place, each in our journey. So now we get to shut down the mind. We get to shut down the eyes if that feels comfortable. And let's just come back into a deep breath in through the nose, filling the lungs, and a long exhale and let it go. Knowing that you just took time for your body. to nourish your body, your mind, creating that strength when you deserve it. Be proud of where your body is in your journey. And just let it go. I invite you to stay here as long as you can to breathe and to rest. We thank you for class.